The role of Warrensburg Health Center is a lot bigger than just Warrensburg. More than 2/3 of our patients at the Warrensburg Health Center don't live in Warrensburg. They live in towns farther north, a bit more remote, but have this as the referral center for the higher tech or the more complex or the after hours and weekend care that we can't provide in those very small towns. We have patients who clearly need services and yet would not receive those services except for them being close to home, that they just won't go to Glens Falls unless it's truly an emergency. And we don't want to wait for emergencies. We want to give all those preventive and basic services right here when the people need them the most. This facility's been here a long time. It was originally the old A&P cement block, almost 50 years, and we've made do. We've made it look attractive, but it's a worn out building. It's not only inconvenient for patients, but structurally blocks the kind of care, the free flow of both information and people that we'd like to see. Last year, mildly to our surprise, we received a federal grant and knew we had the opportunity for a new health center. And we looked everywhere in town and finally decided that new health center would be in the parking lot in the front of the old building. We're going to be right on the corner, on the streetscape, corner of Main and Richards, same lot that we've been for the last 30 years. Over the years, we've had 2 additions. So now we have 18,000 square feet. The new building will be 19,000 feet, except it'll have 2 floors. We're going twice the space. We're building the center for the next 50 years. Healthcare is going back into communities as close to where people live as possible. When people live 20, 40, 50 miles from the nearest hospital, this becomes the destination. This becomes a place where they go to either get the definitive care they need or to become stabilized to go for more acute services out of the area. There are a lot of services. We have primary care, we have urgent care, women's health, pediatrics, imaging services, and a whole range of specialty services, but we think we can do more. There are more kind of specialties we can introduce, more technologies that they can use so we can keep people close to home for the care and the procedures they need. There's going to be a leap forward, a new level of care that up to now we've not only been unable to afford, but unable to imagine. Healthcare is changing in dramatic ways. More and more care that used to be given in hospitals are now given in ambulatory care settings, and this is a kind of ambulatory care setting that those services will migrate to.
Hudson Headwaters is so much more than primary care. Even though I would see my primary care physician in North Creek for specialist care, to have it here instead of going into Glens Falls or Saratoga is just so much handier. Having urgent care here is critical. It's closer, it's dependable, all of our records are here, all of our physicians are here, and it's our health center.
The new health center is going to be an asset in Warrensburg. Urgent care is very important to everybody because we can't plan when we're going to be sick or have an accident. And we need to know that there's some facility that's going to help us.
To have Hudson Headwaters here in Warrensburg with a big pediatric unit is a blessing. I think the children are healthier because they're here. I think that if a lot of the parents had to travel, they wouldn't go necessarily when they needed to go if they thought they could self-medicate at home. And I think with Warrensburg being so available to us and the hours, the 7 days a week, you can always get good medical care no matter what. The OBGYN delivered our last baby. I did all my doctoring right there for the 9 months at the Hudson Headwaters. I get my mammograms annually at Hudson Headwaters here in Warrensburg. It's a great convenience for me and for many other women in the community. I have a 102-year-old grandmother in Warrensburg. She uses the health center, and when she can't get out, the doctor comes to the house to check on her. You don't see doctors making house calls anymore. These are all great things to have available in such a small community. We're quite blessed to have such services right here in our backyard.